Hello and thank you for joining today's masterclass. My name is Crystal and I'm a Dermalogica educator, and with me I have Marie, who is a Dermalogica expert.
Hello everyone. Hello.
So today we're going to be talking everything about pigmentation. So what causes or what triggers the dark spots, the different types of pigmentation that we get, and obviously how we can treat dark spots on our skins. So up to 90% of the consumers who face pigmentation challenges, they say that it impacts their confidence quite a lot. So, and especially I think in Malta, being that we're an island and we have sunshine more than 300 days a year, pigmentation is a very common cause. Yeah. So let's start from the very beginning. What are some triggers of pigmentation?
So pigmentation can be triggered with various factors, starting from UV rays, pollution, hormones, and also from damage to the skin, like from acne, burns, or other traumas to the skin.
Okay, so what you're saying is, like, after a breakout, then it can turn into
yes,
a dark spot.
Yes. So the redness can actually turn into hyperpigmentation, and that obviously is a bit more difficult to fade. So we can treat that with various treatments.
Okay, so we'll be talking about treatments a little bit later on, so stay tuned. So, having mentioned the triggers, now we know that there are also different types of dark spots. What can you tell me about those?
So, there are different types of pigmentation, meaning starting from melasma, which is caused by pregnancy usually, or birth control, which is a mask on the face. It's usually more prone on the forehead and the cheeks, and also the upper lip. There is also sunspots, which is caused by overexposure to the UV rays. Okay, that is more easy to treat. And then there is also the post-inflammatory hyperpigmentation, which is the acne or burns that causes the redness and then turns to pigmentation.
Okay, so we have quite a different variation of triggers and types. So Marie, now that we know about the triggers and the different types, let's switch gears and talk a little bit more about what actually can we do in the treatment room. So which treatment would you suggest for someone with patient challenges?
So Dermalogica came out with a new treatment. It's called Pro Bright, and it's mainly a 3-step treatment using very advanced ingredients like vitamin C, niacinamide, and hexylresorcinol to address pigmentation, dark spots, and for brighter and smoother skin.
Okay, perfect. So you mentioned that it's a 3-step process. What are these 3 steps?
So most importantly, we start from using the peel to remove the dead skin cells and for better product penetration. And for pigmentation, we use the Ultra Bright, which has lactic acid.
Okay.
Second step would be using electrical modalities to enhance the penetration of the serum, which is the Power Bright serum, which is a serum that is specifically for pigmentation and has these 3 very active ingredients. And lastly, we have the bioactivity, where we use the cooling contour mask for the serum to seal into the skin.
Okay,
and
so
also
use the serum deeper.
Exactly. And the Biolumin C, which is a vitamin C serum for brighter skin.
So Marie, can anyone get a Pro Bright treatment?
So the Pro Bright can be tailored to anyone, okay? So all skin types will benefit from it, and also all ages.
Okay, and how often can we do a Pro Bright treatment?
Preferably, a program is tailored to a client's specific skin concern, but it is so safe that it actually can be done every 2 weeks.
Okay. And I know you mentioned that the step 1 during the probe ride includes the chemical peel. Can that be done all year round?
So we can actually power them up or power them down, again according to the skin's tolerance. But usually in the winter months we can power them up because of the UV rays.
Yeah, so because of the
Exactly.
lower UV
Lower
rays.
UV rays.
Okay, perfect. So we've learned all about the probe ride treatment. Is there anything else that we can do at home for someone with dark spot challenges?
So to enhance the effect of the probe ride treatment, we also have home use products. There are 3 in the range of the Power Bright, which is the serum, a moisturizer with SPF, and the night cream.
Okay.
The serum helps to diminish the spots faster and for overall luminosity. Then there is the Power Bright Moisturizer, which is SPF 50, which also helps for oxidative stress and to protect the skin from further damage. And for the night, there is the Power Bright Overnight Cream, which fades dark spots while you sleep and nourishes the skin better.
Perfect. So you've mentioned the Power Bright Moisturizer with SPF 50. Do we need to apply another SPF on top, or?
Depending on how long you're going to stay outdoors, we usually recommend that you apply the moisturizer with SPF in the morning, and if after 2 hours you're still going to be outdoors, like swimming or running errands or hanging clothes, it's best to reapply SPF.
Okay. So do we need to use all 3 products when we're targeting pigmentation?
Not necessarily. Each product is effective on its own, but together they work and provide a more good result.
Okay. And if I were to use all 3 products together, then how do I need to use them?
So, in the morning after cleansed skin, we use the serum, and then we follow with the Power Bright Moisturizer with SPF. And then in the evening, after cleaning the skin, we use the Power Bright Overnight Cream.
Okay, so the Power Bright Dark Spot Serum, we only apply it in the morning. Perfect, thank you. So we've heard all about the powerful trio, but I believe that we also have other Dermalogica products that are honorable mentions when we're talking about dark spots, like the microfoliant, for example. Because of the brightening complex, it helps to brighten our skin on a daily basis. And we also have our Rapid Reveal peel, part of our Age Smart segment. However, with 10% lactic acid, we can target also pigmentation. The Rapid Reveal peel can be applied once a week, and it's a home grade peel. And it's having talked about the Pro Bright, we can also mention that they can do it in conjunction with the Pro Bright treatment to further enhance the results. So my advice to you is find your nearest Dermalogica expert so they can tell you more about Pro Bright and how you can treat your pigmentation. And Marie, if you had to offer one piece of advice, what would it be?
My best advice would be to always use SPF from a young age, because it will also help to protect your skin from the UV rays and also to avoid any pigmentation.